What's up? This is John Doherty, Free PT Now. So I wanted to create a video going over the exercises I made in the previous video, which were some things you can do to deal with shoulder pain. So these exercises, kind of the impetus for that video, came from a question that I get very commonly, which is my shoulder hurts when I bench press. So I wanted to create a video showing some exercises that you can use for if you're experiencing pain when bench pressing, shoulder pressing, or just pain reaching overhead into a cabinet at home or different things like that. Basically, the condition which these exercises are addressing is shoulder impingement, more accurately called subacromial impingement. And I want to talk briefly about what exactly is impingement or subacromial impingement, and why does it cause pain, and why are these exercises effective in combating that pain. So many people talk about the rotator cuff, and for those of you, it's very common. I have lots of patients that come in and say, doctor said I tore my rotator cuff, or things like that, and it is actually cuff, not cup, C-U-F-F. And your rotator cuff consists of 4 muscles. So you have 2 on the back side of the shoulder blade that are involved in external rotation, rotating the arm out. Those are called the infraspinatus and teres minor. Infraspinatus is going to be a little bit more active when your arm is at your side. Teres minor, when the arm is up at 90 degrees of abduction, is going to be more of your more powerful external rotator in that position. On the inside of the shoulder blade, in through here, you have another muscle which is called your subscapularis. It's going to help rotate the arm in this way. And the last of the rotator cuff muscles, the most common culprit, is going to be supraspinatus. It's going to go from the top of the shoulder blade here, come insert on the outside of the shoulder. That one, primary action is going to seat the shoulder in the joint, help keep the shoulder in a good position, especially when you're reaching up overhead. It's also going to assist in abduction, lifting the arm out to the side, especially within the first kind of 10 to 15 degrees. Just if you're a visual person, hopefully this shows up fairly well. This is kind of just an overview. Here are the muscles I'm talking about. You have down here, you got teres minor, infraspinatus. Those are going to be the 2 external rotators. On the top here, you have your supraspinatus. So I'm not sure how clear that's coming through. Looks like it's a little blurry, but wrapping around the other side, that muscle that's highlighted there is going to be your subscap. So if you can see, I'll do my best to get a good angle here. But you have a bone that comes across the back here, and I'll highlight it so you can see it a little bit better, and comes across the front. So that bone highlighted there in green is going to be coming across, and across the top is going to be called your acromion. When it goes across the top, it kind of sits like a hook, and basically all those rotator cuff muscles go right underneath that hook. And so anytime your shoulders are in more of an anterior and internally rotated position, so kind of forward like this, or in more of a superior or upward position, you're going to decrease the space, the subacromial space, which basically means the space underneath that acromion bone, underneath that hook, where those rotator cuff muscles are actually going right underneath. You're going to decrease the space in that area, because when your shoulders are rotated forward, it's going to kind of rotate forward. It's going to start to compress on the structures underneath there, primarily the tendons of the rotator cuff. When your shoulders are forward, again, same thing. It's going to jam up into that space, compress those muscles, and cause pain, inflammation, swelling, and that's why it hurts when you bench press or when you shoulder press, because the bench press movement, the action of the chest is going to be, of your pec major, is primarily going to be horizontal adduction, bringing the arm across the body, as well as internal rotation, rotating it in. So if you're doing a lot of bench pressing and you're not counteracting it with exercises that oppose those muscles, that oppose horizontal adduction and internal rotation, what's going to happen is you're going to start to fall into more of this anterior and internally rotated position. And so you're going to decrease the space in underneath your acromion. You're going to start to pinch down on those rotator cuff muscles. When you go to bench press, you're going to be basically forcing yourself into that position, and it's going to cause pain. So The idea with the 3 exercises I did on the ball in the previous video is to work on the muscles that kind of counteract that that movement, which is going to cause pain. And so the first one, the T, laying on your stomach, is going to primarily work mid-trap rhomboid. So those are going to be the muscles that kind of retract your shoulder blades, bring them together. The Y, coming up in this direction, is going to work lower trap. So it's going to pull the shoulder blades down and back. And then lastly, the row with the external rotation is going to work a little bit of everything. As you row, you're getting the muscles across the mid-back, so you're getting mid-trap rhomboids, scapular retractors. You're also getting a little bit of posterior delt, and then when you rotate, you're getting your external rotators. So that's going to be infraspinatus and teres minor. So you're primarily, with these 3 exercises, working the muscles, what we call the scapular stabilizers, the muscles in between your shoulder blades, or your scapula. And but you do get a little bit of rotator cuff just from the external rotation. And basically along those lines, a lot of people will do, for shoulder pain, basically internal and external rotation with a TheraBand or with a light resistance. And these are good exercises, but the reason they're not going to solve the problem is because if you're already in a position where the rotator cuff muscles are being pinched, when you do internal external rotation, kind of like warm up the muscles before you bench press, it usually feels a little bit better, but you're not doing anything to stop the pinching of those muscles. All you're doing is basically getting some blood flow in there so it feels better, lubricates the muscles, lubricates the joint, gets it feeling better so that when you do the exercise, it feels better, but afterwards you're still having the pain. And the reason, because you're not doing anything to kind of get you out of that position. So in addition to the exercise on the ball, anything that's going to get you out of that position, so laying on a foam roller, arms out to the sides, stretching the pecs, getting you out of that internally rotated position is going to provide a lot of relief. Quickly, I just want to say, if you do these exercises, you're having shoulder pain, there's basically 3 things that could happen. 1, you do the exercises, your shoulders feel great afterwards, pain goes away, perfect. 2, you do the exercise, you get some relief, but not complete relief. 3, you do the exercises, they don't help at all, and they could possibly even cause more pain. So, if number 2 or number 3 happens, I strongly suggest that you seek out a physical therapist locally in your area, and you have a initial evaluation to determine what exactly is the source of your pain. Because a lot of people experience shoulder impingement, but the causes of shoulder pain are innumerable. There's a number of different causes that could actually be the source of your pain. So even though you may have symptoms that sound like impingement, unless you see a medical professional, they do a full evaluation, it is impossible for me to determine what exactly is the cause of your pain just from you saying it hurts when I bench press. So these are some exercises that will most likely give you some relief, hopefully help you with your pain, help you get back to doing the things you want to do. If they do not, I strongly suggest you seek a physical therapist for a full evaluation to determine exactly what's going on, and they can give you additional exercises and guide you in the direction that you need based on exactly what's wrong with your shoulder. So if you have additional questions, please feel free to send them to me on any of my social media platforms at FreePTNow. Thanks again.